If anything good whatsoever is to come out of Roe v. Wade being overturned in the States, and I know it's hard to imagine that anything good could possibly come of it, but it might be that it's at least helping to shine a light on what needs to be improved upon here in Canada. What are we getting right? And where can we do better? I can't imagine a better person to speak to this than Martha PAYNTER. Her book is Abortion to Abolition. She's a registered nurse working in abortion and reproductive health care, and she joins us now. Hi, Martha. Thanks for your time today.
Oh, hi.
I'd like out of the gate just to get your reaction. And I know it's like it feels in some ways like old news now that Roe v. Wade was overturned, and yet I think the implications, it's kind of coming in ripples almost. So what was your reaction to the U.S. Supreme Court striking down Roe v. Wade?
Honestly, it does seem like it's getting worse every day. We hear new levels of just depravity to the details of the implications, right? But obviously our initial reaction as abortion care providers here in Canada is just that, in your gut feeling of solidarity and concern for our colleagues and their patients, right? Like this field is really fulfilling work, and to even just imagine not being able to do your job is it's just so sad. Mm-hmm. And the extent to which this impacts all kinds of sexual and reproductive just privacy and safety in the U.S. It's just horrifying. I like, though, that idea that the resolve, the determination is stronger than ever. When you said that, it immediately, I felt, oh, yeah, okay, no, we're not going to accept this. The women in the states that I know certainly are more determined than ever before to make sure that they, fight for their access to safe abortion. How do you think women here in Canada are affected by this? I mean, obviously nothing has technically changed for us, but how do you think it affects women here, just knowing that something like that happens so nearby? Well, we generally try to use the word patients or people to try to be gender inclusive rather than just focusing on women.
Perfect.
And what we're seeing, of course, a lot of confusion. People absorb news here. I spoke with a patient today who asked me, what are the rules? And to explain to them, there are no rules. And this is a big part of why we don't want any abortion law whatsoever. We like it the way it is, where it's completely outside of the criminal justice system, because we don't want to spend half our time counseling patients to be about, going over the legal system and this regime, right? That's the situation in the U.S. So really what we want to focus on now is, we know in Canada that it may be completely separate from the criminal justice system, but that doesn't mean that it's accessible. And so that's where we have to be doing our work, right? And in particular, there are things, each province has its own idiosyncrasies about how access is thwarted. For instance, one of the things that is really glaring as a to-do item is to address how in Quebec, which is a huge province and has a huge number of clinics, so there's 49 different places are doing aspiration abortion care in that province. But it's very restricted who can prescribe medication abortion. We've had medication abortion in Canada since 2015 in the form of mifepristone. And in every other province, any primary care practitioner, so nurse practitioner, family doc, any of them is allowed to prescribe medication abortion. And that's simply not the case in Quebec.
I did not know that.
So yeah, of course, because we don't talk enough about abortion.
You're so right. And how could we be so
normal? Exactly.
Yeah, we're so forward thinking on the one hand, right? And like you said, 49 clinics here. So, in terms of accessibility.
Birthplace of abortion, Morgentaler's stomping ground, right?
Exactly.
But this is a very serious problem. It means there's 7 million people in Quebec, I think. And So things like that, right?
It makes it more complicated, right? Ultimately, it makes it more complicated for if it's not easily prescribed, it makes it more complicated. Martha, I'd love for you to speak a little bit on Dr. Henry Morgentaler's role in making abortion a health service for anyone who doesn't know how, what a hero he was.
Such a very important part of Canadian history. The 1988 Morgentaler decision, where the Supreme Court ruled that there could be no criminal proceedings against Dr. Morgentaler, who had been charged multiple times, tried multiple times, and always acquitted by juries, because it simply doesn't make sense to have abortion governed by the criminal code. So as of 1988, it was removed. There were no restrictions. There's nothing. There's no restrictions on age, on gestational age of the pregnancy. You don't need a referral according to law or anything like that. There's no waiting periods. There's nothing. It's just clinical care. And so you deliver clinical care according to best practice guidelines, right? Mm-hmm. Which change as we learn more things. So it's really monumental because Canada is really the only place where that was the case. New Zealand recently very recently decriminalized abortion, but for decades, Canada was this incredible outlier in that we just treated it like healthcare. Mm-hmm. That's what it is, and that's still how we treat it, right? So really, I mean, people need to understand that Morgentaler fought this for decades. He was imprisoned. He had a heart attack in prison. He literally put his life down on the ground to serve the people of this country, to make this a reality for us. And he died in 2013, and he is absolutely a national hero.
Yeah, I couldn't agree with you more. I got goosebumps as you're describing like what he went through to make it easier for us, for all of us as Canadians. Martha, again, we're speaking to Martha Paynter. Her book is Abortion to Abolition. She's a registered nurse working in abortion and reproductive health care. So let's come back to this medication abortion. And I'm shocked by what you said, that it's complicated in Quebec. Why is it so? And how difficult would it be to make it easier to get those prescriptions?
So every other province, the College of Nurses has authorized nurse practitioners to prescribe it, and the College of Physicians is on board with this. And so there's some, it's hard to understand exactly how it works. Sometimes that's how this is, but basically there's some just reluctance from the College of Physicians to allow expansive prescribing authorization. And it's not based on science. It's really kind of a turf thing, which when we look at how really this is, abortion is so fundamental not only to our health but to our democracy, to participation in the economy and the political life and education, civic engagement. Like, you need abortion. Otherwise, people aren't free to live their lives. And so to have access ever caught up in something silly like somebody's turf war, it's not okay.
No.
Right? When we're looking at this moment in Canada and thinking, okay, what can we do to make access even better so that we're a better refuge for our U.S. Neighbors who need to come here, should they want to, should they need to, but also so that we can be even more proud and more confident in what we offer. And so there's a list of items that we can address, and that's one of them. And, in some provinces you can count the number of known, maybe people are doing it, but they're not telling anybody. I mean, that's useless if you don't know how to find somebody. But the known medication providers, you can count on one hand. So that's no good when it could be thousands upon thousands of access points. Really, we need to be teaching about medication abortion prescribing in every single medical school and every single nursing school so that no one's graduating with this as some foreign concept that they don't know how to do. It's incredibly basic, right?
Hear, hear.
So that's, some items on our to-do list to really improve access. Medication abortion isn't a great option past 9 weeks. So, obviously we're still going to need aspiration abortion services, or sometimes what's called surgical abortion services. But medication abortion, really, it's revolutionary for a country of this size.
And the accessibility has to be there. When you said turf thing, I'm like, are you kidding me? There should never be a question of turf when it comes to health services. You wouldn't hear that happening over a hernia issue or whatnot. So I'm so glad.
You might.
You might. Yeah, you're right. Actually.
You might. Because it's people's livelihood, right?
Yeah.
It's like that's how we do clinical care in this country. You do it and then you get paid to do it. So if somebody else is doing it, you don't get paid. And that's okay. We need to acknowledge that, but there's more than enough work to go around at this point. We're in such a crisis in pretty much every domain of healthcare delivery that,
it's okay if it's not impeding. Sorry, go on.
Scope.
Say that again, Martha. I spoke over you.
We all need to work to max scope. So whether that's a licensed practical nurse, a registered nurse, a nurse practitioner, an occupational therapist, everybody's got to be working to their max capacity in terms of what they're able to do so that we're not wasting time passing people along the line that we could have cared for ourselves.
And there should be nothing impeding access, especially not turf war, as you say. Obviously, there's so much more to talk to you about, but I'm out of time. I really appreciate your time today. Thank you, Martha.
Oh, my pleasure. Have a great evening.
You too. That is Martha Paynter, Abortion to Abolition author. Again, she's a registered nurse working in abortion and reproductive health care.